For many seniors, falling asleep in a recliner or upright chair becomes a nightly habit. It seems harmless, even comfortable. After all, recliners reduce pressure on the back, elevate the legs, and feel cozy enough to drift off in. But what most people don't realize is that sleeping this way night after night can quietly damage the body, and in some cases, it's proven fatal. Cut 2. The man wakes up in the morning, clutching his leg in pain. He struggles to stand. Visibly weak and short of breath, narration continues. When the body sleeps in a seated or semi-upright position for hours, circulation is compromised, especially in the legs. Blood can begin to pool in the lower limbs, increasing the risk of deep vein thrombosis, or DVT. These clots can travel to the lungs, triggering a pulmonary embolism, a silent killer that can strike during sleep or shortly after waking. To medical illustration, animation shows blood flow slowing in the legs, clot forming, and then moving toward the lungs. Narration: it's not just blood clots. Sleeping upright restricts full lung expansion. Over time, this can decrease oxygen intake, stress the heart, and cause shortness of breath. Seniors with heart failure, COPD, or sleep apnea are especially at risk and may never wake up after. One bad night. Cut 2. A family member finds the man slumped in the chair the next morning, unresponsive. The mood shifts to serious and quiet. Narration: these are not rare cases. Every year, thousands of older adults are found in their chairs, having passed away quietly in the night, not from old age, but from preventable sleep-related complications. Scene transition. Text appears on screen. What you can do. Narration: if your loved one frequently sleeps in a recliner, talk to them gently about returning to a proper bed. If mobility is a concern, consider an adjustable bed or wedge pillows. To support their posture, encourage leg movement during the day, and speak with a doctor if swelling or pain in the legs becomes noticeable. Closing shot. The elderly man is now shown lying comfortably in a bed with good posture, soft lighting, and a peaceful expression. Narration. Closing line: comfort should never come at the cost of safety. Don't let this quiet habit become a deadly mistake. Pay attention and help your loved ones sleep the right way. An elderly woman sits on the edge of her bed, holding a small bottle of sleeping pills. She sighs, then takes one, then a second, before lying down. The room darkens as she closes her eyes. Narration voiceover: for many seniors, falling asleep doesn't come easy. Restlessness, anxiety, pain, and medical conditions often make nighttime the most difficult part of the day. In search of relief, they turn to sleeping pills, a habit that feels like a solution but can quietly turn into a deadly routine. Cut 2. A close-up of various pill bottles labeled sleep aid, tranquilizer, or containing terms like zolpidem or benzodiazepines. Background music becomes tense. Narration continues. What starts as an occasional dose to get through the night can quickly become dependence. The elderly body processes medications more slowly, making even small doses risky. Pills that seem harmless at first can accumulate in the system, leading to oversensation, confusion, slowed breathing, and in some tragic cases, death during sleep. Cut 2. The woman is shown asleep, breathing shallowly. A loved one knocks on the door. She doesn't respond. Narration: the most dangerous part. Many seniors combine sleeping pills with other prescriptions like blood pressure meds, antidepressants, or painkillers. This cocktail effect can depress the central nervous system, causing the heart rate to drop dangerously low. Often, the warning signs come too late. Cut 2. Footage of a doctor speaking to a family, explaining the risks of long-term sedative use in the elderly. Narration continues. Sleeping pills should never be the first or only solution. There are safer alternatives: guided relaxation. Sleep routines, light therapy, and cognitive behavioral therapy can all improve sleep without the deadly side effects. Closing shot. The elderly woman is now seen journaling before bed, sipping chamomile tea, and turning off devices early, a healthy nighttime routine. Narration. Closing line. Don't let sleep become a silent killer. Watch the pills. Watch the doses and protect your loved ones from a danger they never saw coming. An elderly man slowly walks to his bedroom at night. The lights are dim, turns off the lamp, gets into bed alone, and pulls the blanket up. The house falls silent. Narration voiceover. It's something we often don't think about, a senior sleeping alone. It seems normal, independent, peaceful, but for many elderly people, sleeping alone, without any form of monitoring or emergency support, can be incredibly dangerous. In fact, it has already cost lives this year. Cut 2. The clock shows 3 a.m. The man is shown stirring slightly, breathing unevenly. His face shows signs of discomfort, but no one is there to notice. Narration continues. Heart attacks, strokes, and breathing complications often happen at night. And when no one is nearby, or there's no alert system in place, the chances of survival drop significantly. A matter of minutes can mean the difference between life and death. Cut 2. Family member the next morning knocks on the door, calling out. No response. They open the door and find the elderly man unresponsive in bed. Narration. Too many families discover too late that their loved one passed during the night, completely alone. A simple fall, a drop in oxygen levels, or sudden heart failure can go unnoticed for hours. Scene shift. Show a wearable medical alert device, bedside motion sensors, or smartwatches with fall detection. Narration continues. The solution doesn't have to be invasive or expensive. Wearable medical alert systems, bedside monitors, or even smartphone-based check-in apps can alert caregivers immediately. It's about creating a safety net, even when someone wants to live independently. Closing shot. Now the elderly man wears a simple wristband while sleeping. A caregiver checks their phone in another room and sees an all-okay status. Narration closing line. Sleeping alone isn't the problem. Sleeping unprotected is. One quiet night can become a tragedy unless we act before it's too late. Many seniors don't realize the dangers lurking in their own bedrooms. Poor air circulation. When windows and doors remain shut for hours, carbon dioxide levels rise, oxygen levels drop, and the air becomes stale. For an elderly person, this silent threat can be deadly. Cut 2. A graphic animation shows the buildup of carbon dioxide inside a closed room. Oxygen molecules decreasing and a person's breathing becoming labored. Narration continues. Reduced oxygen intake during sleep stresses. The heart and lungs, especially in seniors with respiratory conditions like asthma, COPD, or heart disease. Even without these conditions, breathing stale air all night can lead to headaches, fatigue, and a weakened immune system. Cut 2. The elderly woman tosses and turns, gasping softly for air. She coughs repeatedly but can't open the window. Herself. Narration. This lack of fresh air can worsen sleep quality and trigger dangerous complications such as asthma attacks or heart failure. The risk increases if the room contains sources of indoor pollution like cigarette smoke, heaters, or mold. Scene tip. Show the window being opened slightly, curtains fluttering with fresh air coming in, and the elderly woman breathing more easily afterward. Narration continues. The solution is simple but often overlooked. Open windows regularly. Use fans or air purifiers, and avoid smoking indoors. Make sure bedrooms are well ventilated to keep the air fresh and safe for a good night's rest. Closing shot. The elderly woman smiles softly as she breathes deeply in the fresh circulated air. Soft morning light floods the room. Narration closing line. Good air isn't just about comfort. It's a vital lifeline. Don't let poor ventilation turn a peaceful night into a fatal risk. Sleep is vital at every age, but especially for seniors. Yet the amount of sleep they get can be a hidden danger. Both sleeping too long and sleeping too little are linked to increased risks of serious health problems and even death. Cut 2. The elderly person sleeping excessively wakes up groggy and confused. The other person, struggling with insomnia, looks exhausted and anxious. Narration continues. Oversleeping can be a sign of underlying illness, such as heart disease, depression, or neurological conditions. It may also weaken the immune system and increase the risk of blood clots. On the other hand, chronic sleep deprivation, sleeping less than 5 or 6 hours a night, raises blood pressure, stresses the heart, and impairs brain function. Cut to medical animation. Visuals show how poor sleep impacts heart health, immune response, and brain activity. Narration. Studies show seniors who sleep too much or too little face higher rates of heart attacks, strokes, and even premature death. Achieving balanced sleep isn't just about feeling rested. It's a critical factor for survival. Cut 2. An elderly couple follows a bedtime routine: dim lights, limited screen time, relaxing activities, and regular sleep hours. Narration. Continues. Encourage your loved ones to establish consistent sleep schedules. Avoid stimulants late in the day, reduce noise and light disruptions, and seek medical advice for ongoing sleep problems. Proper sleep hygiene can save lives. Closing shot. The elderly couple peacefully falls asleep in a cozy, well-ventilated bedroom. Narration. Closing line. Remember, when it comes to sleep, more isn't always better, and less can be deadly. Find the right balance to protect your health and your life.